we've seen an incredible focus on the topic of healthcare and healthcare resources during this pandemic. And just be curious how the work that you guys have been doing fits with some of the things we've seen over the last couple of years.
Sure. So the pandemic has had an effect on us, many ways. One is as a workforce that had to transition very quickly to a remote workforce and still do the work that we needed to do for these entities who were now in very much in need of the support that this program offers, was something that we did, very seamlessly. And I have to credit my team for being, resilient and flexible and committed to what we do. But the healthcare providers in general, they're being taxed. There's no question. There's a lot of demand on what they do. And I've seen it with our parent company firsthand that Hudson Headwaters Health Network, along with many of the other FUHCs and hospitals throughout America, had to build temporary structures to actually provide testing and treatment for patients, so that they weren't exposing the staff inside the buildings, on the outside of the buildings. And it's challenging, as you can imagine, in upstate Vermont and upstate New York, when the winter months hit, to have structures that you can, provide service and testing for and actually handle the population and the many people who are in need of the services around the pandemic. Now, with the pandemic, the funding that 340B provides to these entities is critical. And many challenges of eligibility verification also were introduced because a lot of the regular healthcare visits, let's say for like a well visit, were transitioned from in-person to telehealth. And telehealth wasn't initially contemplated as an eligible encounter to establish the eligibility for 340B.
Right.
A patient has to have care provided by a provider who's employed by under contract with or other arrangement with the entity who's eligible for 340B, so that the care is documented in the medical record accordingly to verify that that patient's eligible for the 340B program. So there are certain challenges that policies and procedures had to be retooled and all of that.